One of the first things I did when I learned I would be going through treatment was prepare a bag to carry with me with all the essentials so I wouldn't really have to think about it or scramble before I leave the house. And it's still evolving. I've only had one treatment, but I carry it with me to work and to all of my appointments, to the cancer center. It's an important part of my day, having this bag. So this is the canvas bag that I do carry. It was a gift after my residency from one of my patients, like a thank you, kind of good luck, farewell gift. So this is what I use. I have my scarf. It's a silk scarf my husband brought back from a trip to Dubai. And obviously it's very special to me, but silk is nice because it can be cool and it can also be warm, and it's a good size I can wrap around myself. They have blankets, but I like my scarf, so that goes in. I also have a small towel. This is some piece of swag from work, but I spilled one of my water bottles in my purse. I had this, blotted it up. It's perfect. You never know when you need a towel. I have these notebooks. First is my take notes in the doctor's office. Either the patient should take notes or their caregiver. Really important. Don't try to commit things to memory. Write things down. Even if you think you'll remember it later, you probably won't. So have a couple of pens and a notebook. Always good to have on hand. I also have my calendar, my weekly calendar, with pictures of funny dogs underneath water. So it makes me smile every time I look at it. I have friends' phone numbers in here. I have schedules on medications, just various appointment notes. Same stuff is probably in my phone, but I find it easier to look in a book. A lotion bar and lip balm, organic, of course. These were a gift from a friend. They're actually from Portland, Oregon, where I used to live, so I love things that are kind of handmade, naturally scented, organic. Chemo is drying. You want to keep your lips moist, your skin moist, your nose moist. I have saline nasal spray. Phoenix is dry, so that's always good to have on hand. A little hand sanitizer. I didn't look. This should just be alcohol, no chemical. I'll read it later. We're setting this aside. But hand sanitizer, alcohol-based, it's good to have. I also have one at work. It's an essential oil one, so maybe I'll swap this out for that. But for now, that'll do. I have my anti-nausea wristbands. These are known as Psy bands. I have two pair. I have one in my purse and then one in this bag. They are designed to go over an acupressure point in each wrist. I use them in travel. It's really bumpy flying into Phoenix. I tend to get airsick, so whenever I fly back home, fly out of here, go on a long car ride, get chemo, you put them on for a sign of nausea. Gum, because you're not always near a toothbrush. Peppermints. They are good for when you're getting a port flush and you get that weird taste in your mouth. Just pop in a mint. You can spit it out afterwards, but just to kind of kill that taste that some patients makes them nauseous. Something else that's mint that is helpful is the Stop Nausea Inhaler. It's essential oil. It looks like a Vicks vapor rub type of inhaler, but it smells mintalicious. and it can help you kind of bridge between getting nauseous and getting to your meds. Or if you walk into a cafeteria and it smells, and the smell of food gets to you, makes you nauseous, just pull out your inhaler. It's a lifesaver for a lot of patients. Emla cream and Band-Aids. That goes over the port about an hour and a half before port access to numb the area so you don't feel them sticking a needle in you. This is my PRN bag, I call it. It has the medications that I need on a as-needed basis. Anti-nausea medications, various homeopathic remedies, and slippery elm lozenges, which are good for cough, dry mouth, mouth sores. I also have my PowerPort band in here, which I probably should be wearing, but it's in my bag. Candied ginger, wonderful, wonderful for nausea. Ginger ale, ginger tea, ginger chews. I like the candied stuff. It's my one little vice. Sweet and spicy. Prevent nausea, have a snack. I'm so prepared for nausea. It's yet to happen. I'm so ready for it. I have my Emmy bag. You can throw up, throw it away. Trameal, great for bruising from vein access, aches and pains, good first aid kit thing. Always keep that on me. Earplugs, yet to use them, but you never know. Clean your eyeglasses. My glasses are always dirty. Put that in the bag. ID badge for work. ID badge for being a patient. My day-to-day pill box, as opposed to my big weekly one. Every day I just kind of load this up with the pills I need to take while I'll be at an appointment or at work, and that way I don't have to lug that huge box around with me. So that is what is in my chemo bag.